establishing an employee assistance program is one of the best things, one that has direct resources to mental and behavioral health. Society's perspective of addiction and alcoholism has come a long way, especially just in the last decade, with its prevalence and notoriety, I guess. But there are still a lot of people that see it as, a moral failing, and that, this person, they're showing up late for half of their shifts and they're not productive at work. And that means then, of course, because it's the way humans operate, we make an internal value judgment based on what type of person that is. But the reality is, if they're struggling with alcoholism and addiction, work it's an afterthought. And so it's not, it's usually not a choice that they're going to make. Hey, am I going to show up to work on time today? Am I going to figure out a way to drink under my desk or whatever it is? That the part of their brain that makes those decisions has really been hijacked by their addiction and by the reward center. I mean, the stigma is always going to exist, right? There's always going to be that divide between whether alcoholism and addiction is a choice or not, whether it's a moral failing or something that we can control. And I just think the more employers and society in general could really take the scientific evidence that exists and look at what alcoholism and addiction does to the executive functions in the brain, and how drastically it shuts those down and increases the reward center, the limbic system, the drive, that doesn't, the decision really, any rational decision making capabilities are pretty much removed. And I think understanding that really would go a long way towards the willingness to support people who are struggling with alcoholism and addiction. But really just, from an employer's aspect, working where I work, it's kind of understood, right? That there's going to be somebody on the staff, just because so many of us are in our own recovery. That's why we choose to work in this industry. That we've been, lucky in terms of most of our employers understand it because we treat it every day. But I don't think that that's necessarily the case in other industries, although I know, medical professionals, obviously the restaurant industry, the construction industry, those ones where it's much more prevalent, they've come a long way towards supporting their employees. But there are certainly a lot that are behind the times, and just having having the ability, whether you think you're going to need it or not, just setting up those resources, whether they're financial or, whatever the case is, just to make the resources available. Because if an employee feels completely ostracized by what they're going through, they're more likely than not to continue hiding it and letting the disease progress and develop and create new ways to hide it and new ways to deflect from it, rather than addressing it, resolving the problem if they can, and then ultimately getting back to work.